Hello and welcome to another episode of Tips from the Top. I'm Rick Barron and I'm here with my co-host,
Veronica Sanford.
Thank you for joining us today. And we're excited today to have with us Dr. Steve Feagins, the Vice President of Medical Affairs at Mercy Hospital Anderson. Dr. Feagins has been serving his patients in this role since November of 2009 and last summer accepted the same position at the Mercy Hospital in Clermont. Dr. Feagins has had a diverse career, serving in product development for Procter & Gamble, as a physician of internal medicine and flight surgery with the U.S. Air Force, and as an instructor at Wright State University. Dr. Feagins also serves as medical director of the Mercy Care Clinic. Thank you, Dr. Feagins, for joining us, and welcome.
Well, thanks for having me.
Would you please give us a little background on yourself, your leadership experience, and the organization that you're a part of over at Mercy?
Yeah, so we're part of a great organization in this township as well as Cincinnati, Mercy Health. And Mercy Health is the largest healthcare provider for inpatients in Cincinnati. And so the Anderson Hospital, where I serve as the Vice President of Medical Affairs, is like the chief doctor, the physician executive. And I also do some patient care, but mostly I'm part of the administration, part of making the experience and the clinical care good for everybody. And that's kind of what physician executives do. Instead of treating one patient at a time, we treat the population. We treat kind of, in a sense, all of those who come to our facility or come to our healthcare system to be served.
And was this something that you aspired to going through medical school, or just something that evolved in your career?
You know, the college, American College of Physician Executives and others, they kind of have these tracks. And for me, it was something that came afterwards. So I worked as a chemical engineer for Procter & Gamble and left to become a physician, to go ahead and do that, and took an Air Force scholarship to do that, and got my MBA before I did that. I did that because I didn't like bureaucracy. I didn't like to work in big organizations and do all kinds of memos and stuff like that. I wanted to own my own business, and was fortunate to get a scholarship. I paid for that scholarship by serving my country, which was very rewarding, helped me a lot, and then started a solo practice. And for 9 years, I was a solo physician and a small business owner, and gradually through that 9 years, got back into administrative type things, through medical directorships, through chiefdoms, until it became a full-time job. And I moved to Cincinnati from Springfield in 2009, fall of 2009, and really been pleased to be here. It's a great place to be. It's a great hospital, a great system to be associated with, and we've done some great things. And so where I left, I was the doctor who did administrative things. When I came here, I was the administrator who did some doctor things.
So that means, in my point of view, that you did a little bit more administrative than you did when you were solo practitioner. And for example, you had said that, if I understood you correctly, that when you were with Procter & Gamble, part of you was tired of writing the memos, and you wanted to be in your own businessman. But you've given up a little bit of that. Did I misunderstand?
No, it's true. And P&G, kind of developing products and whatnot, what a fortunate thing to do. But it is a bureaucracy, and so wanting to be a small business owner and doing that, and physicians are unique. When a physician owns the business, they're not only the business owner, they're the chief worker. Physician doesn't do anything, nobody earns any money. And so the entire staff, 3 or 4 people, are really beholden not upon the boss for leading them, but for doing the work. And it's a unique thing. But it's moving now. Physicians are less and less independent. Most of the physicians, in fact, there are less than 10 independent primary care physicians in all of Cincinnati right now. All of the, at least for primary care, work for some kind of system for a number of reasons. And that's a unique challenge today, is to try to work with that, to create that sense of entrepreneurship within the physician community when the physicians are employed by a system. The folks in the office are employed by the system, but they're still the doc. They still have to lead that office, still lead that system. And that's kind of the challenge that we work for, and that's fun. That's fun to do.
Thank you. As a successful leader, what steps have you taken to get where you are? Have you had mentors or things that you did?
Yeah, presuming that's I'm successful, of course. And so through the years, the mentors for me have been technical mentors. They've been great academic physicians who are just like smarter than like smart, and you follow that, and then you move on to physician executives, and the former chief medical officer of this region, Randy Randolph, who's a 2-star general in the Air Force, who actually recruited me here, who encouraged me to be here, kind of knows both sides of it, not only the military side, but also the sort of physician executive side. And Randy was unique in actually creating the physician executive within Mercy Health, the role of the Vice President of Medical Affairs, which didn't exist at this hospital, 10 years ago, but emerged and has now become a very necessary role to be the physician on the executive team.
Thank you.
All teams are just that, they're teams. So they have people coming and going. How do you find and develop the leaders that you bring onto your team?
Yeah, and that's a big part of what I like to do. I like to work with colleagues, for those that desire to step up to that medical directorship, create a format for them to not only cultivate them, but also to have peers, and we call it combined leadership. And so all the medical directors, the various specialties, work together, not only between their specialties, because that's really that transition, that cardiology to internal medicine to emergency medicine, but also within their own structure, because they lead their physicians. And so it's great to have that cross cultivation, or not only one-to-one, we're working within that specialty, working with you as you lead and not only represent your constituents but communicate back to them, but how you communicate and how you work with the other specialties, and how we make a commitment and how we follow that commitment. That's hard because it's easy for us to sit around and say we're going to do this thing. Then you get to go and explain to 20 of your physician colleagues that you agreed that we would do this thing. And so that's how we how we go.
Yep.
And why we do that. And so it's actually great. It's great to work with colleagues who want us to be better. We're really good. It's not good enough. Let's be better. And when we kind of work together, we can make all of us better. And it's great to see that, because physicians are a very independent type of practice. We throughout all our training, we have to be better than the other guy. We have to be better than this and better than this. And so it's not necessarily in the nature to work as a team. And so we cultivate that. And I think that physician training in the last 10 years has been much more around teamwork. But where does a physician become a leader? What in the physician training teaches you to do a performance appraisal, to give constructive feedback to a colleague or to one of the staff, to sit down and look people face to face and say, we're unable to do this contract and here's why. And so it's part kind of indentured servitude. You do it by doing. That's how you learn to be a doctor too.
How many direct reports do you have? How big is the team that you manage directly?
So interesting. My actual team is not that big of people that directly report to me, but the team, the people that I influence is 20 or 30 different physicians in different areas, but they don't actually report to me. Some are contracted, some are employed by the system, some are independent practitioners. And the challenge there is, and that's actually the VPMA, the Vice President of Medical Affairs challenge, is to lead people who don't report to you, is to herd the cats.
Thinking the same thing.
That may or may not be beholden to you, but are beholden to a vision that you have, to a future state that we can articulate together, to a better hospital that we would want, like our family, and to refer people to, and to work as the colleagues that we want to be. And so, it's okay if you aren't able to do that. It's all good. Not on the team, but we'll find somebody to be on that team. And it probably works out better that there's not a direct reporting relationship, because you have to create this sort of mutual respect. And part of it is, yeah, I'm the administrator, it's okay. But also, am I a good doctor? Am I someone that you would want to refer to? And are you someone that I would want to refer to? Because at the end of the day, it's about the patient. Mm-hmm. Our product is good patient care, good patient experience, good family experience. And at the end of the day, we have to declare people dead. We have to see people on the worst day of their life. Of those, however many moments in life there are, the one that was the absolute worst is when we had our interaction. And so how we support each other after that and during that, people watch. And one of the professions of my colleagues is kind of the most watched profession. People are always watching you and how you act and how you interact. And so we got to be above. We got to be above, and demonstrate by our own respect for each other and for our staff and for our patients. And that's how we hold each other accountable to doing that right thing.
Thank you. Thank you. Well, I've been a project manager. And one of the things as project manager, very often the people who are on our team don't directly report to us. And we have to give them the vision. And if they all buy into that vision of the better, the bigger, the more efficient, whatever it is, then we all work to build towards that. But that's part of our role as leaders, is to give them that vision, because without the vision, they're just filling a spot and they don't have the passion. But if you can encourage people's passion, they'll follow you anywhere.
Right, and contribute to the vision, yeah.
So what advice would you give, Dr. Feagins, to a young, aspiring leader? Somebody, even if it's not in the hospital or a medical profession, but somebody out in the world just trying to get by? Yeah,
and we actually have a fair number of interns and folks from Xavier and folks coming with us, and the advice is do things. If you sit and you think someone's going to know about you, it's not going to happen. Do things. Get into the community. Volunteer. Obviously, I work with a lot of docs. Sports medicine's a big passion of ours. Get on a sideline. Be a team physician. Go to the schools. Teach some classes. Get out of your comfort zone and actually get out there and lecture. I'll put you on the noon conference. You can lecture. Do it. Get uncomfortable and then do it. And do things. And so the more that you do, communication-wise, being a part of the community, interacting with people, the more you actually accidentally develop those skills that allow you to move into a leadership position. Because leadership, to me, at least in my world, is about influencing people. It's about encouraging people to do the right thing. Much of what we do in medicine is that anyway, but we don't have to boss them around, as it were. Just get out there and do things, and people will notice you.
Thank you.
Dr. Feagins, having had a career that spanned almost 30 years, has your leadership style changed over time?
I don't know. So if you look back, if I think about, when I joined Procter & Gamble as a chemical engineer, we went through leadership training. What I learned there is how to communicate. Most importantly, how to stand in front of whatever PowerPoint predecessor was, and actually give that presentation to get that product. I learned some about written communication, but not enough. The best management training that I've ever seen is officer training school in the United States Air Force. That is where you truly learn to lead. That is where they literally teach you step by step how to be a leader. And then when you're out doing on the flight line or doing the flight surgery, you do that, and people hold you accountable. And then part of various seminars and whatnot that kind of teach you the techniques of how to do that. I don't think that my leadership style, because I'm a more of a kind of here's the vision, let's go, has changed. But some of the techniques, you evolve. Some things work, some things don't. The people that you're working with change. The biggest thing for me is the generations. The way that we interact with the 4 different generations, if you think of physicians, and all different levels of practice, how we communicate, how we do. The resident physicians that I help to train, very different. The text messaging and things like that. And so Adapting to the different generations has probably been the most recent change for me, is because I have to sort of lead all of those and get them to work together.
Thank you. So if you've just joined us, please know that we are Tips from the Top, and we are speaking to Dr. Steve Feagins. He's the Vice President of Medical Affairs at Mercy Anderson and Mercy Clermont. There's certain values or principles that you've held, like golden nuggets that you can share with us and the audience?
So, in terms of 2 or 3 things that I think have been very helpful, one is about honing your communication skills. And I think that written communication skills are incredibly important. And that was a struggle for me. And you can imagine, engineering school, you don't really learn to write. And so you start to write reports and things like that, but they're not well written. And so I took it upon to really force myself to do that. And today I produce a weekly newsletter that goes out to 3,500 people every week. I make myself do it. I make myself write those 3 sentences that it can explain something. I make myself communicate written in order to influence. And it's been something that I've really worked to do. A lot of people today think that I've been a writer, all my life, and that was something that I had to work on. Same thing with the communication, the ability to sell a product, to sell a vision, to sell an idea, both with the PowerPoint and whatever. I think those are tremendously huge no matter what you do, the communication skills. The other value is be in the community. One of the things that we always say, if you want to see the future, go to your local schools. If you want to influence the future, partner with your local schools. Mm-hmm. And so that's what we do, and it takes time from my day. We have the medical explorers, we take them around, we do stuff. They dissect things, they do sutures with the Forest Hills District and others. We have shadowers, we have the residents, we have all kinds of things. We were at Nagel Middle School this morning doing a project to design our new dining area. And so get out there and be in the community. And then the final thing that's been important to me is no matter what you do in leadership, there was some technical skill or technical background that got you there. And don't forget that. And physicians especially. And so there was a time when physicians who became physicians in leadership were really encouraged to get MBAs and do finance and do all this stuff, get in the boardroom, understand that, which is important, but it caused a lot of them to actually stop being doctors, stop practicing. And you lose what it is that made you unique in the first place. And so whatever technical skill, engineering, nursing, whatever technical skill that you bring to the boardroom or to the executive suite, don't forget that. And that's been real important to me for, just what little, a free clinic, the Mercy Care Clinic, working with the residents, working on a weekend as a hospitalist. All those things keep me current because it's very easy to get out of date, very easy. Keep me relevant. And give me, that credibility with not only my colleagues, but my non-physician colleagues, because yes, I still am a physician, I still understand what it is, even though it's fewer hours than a full-time physician, but I just think that's really important. And the various physician leadership organizations have picked up on that in the last 5 to 10 years, where they were telling everybody to get out of their practice, now they're telling everybody to get back into practice. And so it was one thing I landed out right was like, I knew that all along. So we landed right there. And I think that's important to remember. Don't lose the technical thing that the expertise that really kind of got you there. Just expand upon that and use it in the administrative role.
I just have to say, maybe you'll say it, TV Toastmasters. Do you want to add to that? Communication.
Communication is something that's typically expressed by many of our guests. And as we look back on the leaders across time, many of them were all great communicators. And Veronica and I are both members of TV Toastmasters, and we were talking before the show about Toastmasters and how that can provide a venue for people to practice their communication and their leadership skills. One of the things that I want to ask about the point that you made we haven't heard from guests the last point that you made about the technical skills and keeping those current. I want to ask it in terms, I mean, you talked about it in terms of staying current with respect to the everyday skills of being a physician. Can we flip that over and talk about certifications or other kinds of things that would help people do that? Do you see a place for that, or is it just keep doing what you were doing so that you can know what's going on in the world of that you come from?
Yeah, in my world, this is part of my contract, that I keep my board certification as an internal medicine physician, that I keep my DEA number, my license and everything up to date. Obviously, you continue to have some kind of practice to be able to do that. There are physicians in Congress who maintain their license, and they have to go I know that Dr. Winstrup, who's our physician podiatrist, he actually works at the VA up in Washington, and he probably wouldn't mind me telling that. And it keeps him relevant. It's one thing to go to the VA as a congressman and get the tour. It's another thing to go over there and operate. And go in the operating room, work with the team. Completely different. Yeah, it's still the congressman operating, but you're really doing it. It's one thing to, in my job, to be the vice president, the VPMA, walking around, how's everybody doing? It's another thing to that Saturday, I have 20 patients to see, and we're going to round together with nursing. We're going to go to the lab. We're going to see how things, if I order something and it takes 2 hours to come back, well, probably my colleagues are having the same experience, and I can see how that works.
So, did you want to ask about him being a flight surgeon?
Did you miss this one?
I did. What would have helped you in your leadership path? What do you wish you had known?
When? You mean like years ago?
Yeah,
or?
growing up. Things that in retrospect, when you're looking back and you go, gosh, I wish I had known that when I started.
Yeah, somebody once asked, what would you do differently? And I don't think anything. I kind of would like to have not known how hard things are as you go into them. It's like, well, I'm not sure I'd do that again, but you did it, I ran track at University of Tennessee, really hard stuff. You're like sore every day. When, and you were going to ask about flight surgery, I wanted to do that because I want to do sports medicine. So in the Air Force, in order to get what's called FAQ, certificate of qualifications for sports medicine, you also have to do flight surgery. Like, okay, fine, that sounds good to me. And this is kind of hard in the desert of San Antonio for a good 6 weeks of unpleasantness. And so, I'm glad I didn't know. I'm glad that you sign up for stuff, you commit to it, you go. Officer training school, that's not the most pleasant of things. And so, but glad I did that. And medical school, I was, before I went to medical school, I'd never been in a hospital other than to volunteer for the obligatory interview so that I could say I'd been in one. I actually was kind of scared because I had my first rotation was like trauma and the county medical center and, people dropping like flies. And okay, I'm glad I didn't know what it was going to be like. And afterwards, we did it. So, it's an interesting question about what would you do differently, and I don't think there's anything. And it's kind of one of those things that when you set your mind to it, do it. Don't and finish it, and the unpleasantry will be over pretty quick.
Not everybody has that. Not everybody has that. Sometimes people get to a certain point, and even though they still want it, and even though they lack that belief in themselves, so somehow you got that. Somehow you got that.
Dr. Feagins, having spent 6 years in the military, is there a difference between leadership in the military and now in civilian life?
There's a lot of, I think, more and more military principles that are actually being applied in at least healthcare leadership. I see it in other areas as well. There's a lot of former military officers. Procter & Gamble recruits former military officers who are getting out. And so one example is my combined leadership. The way I structure the medical directors and the way we work together, that's completely from a military briefing. It's completely the way that we would discuss things. When we are looking at a request for proposal, and we have, say, 16 people for techs, for other people, nurses, administrators, physicians, the so-called lowest ranking person in the room goes first. And so the techs give their opinion of that group or that situation first, followed by the next level, followed by the next level. And I put the physicians last, whatever. And by the time the physicians speak, they pretty much seem to have taken on the opinion of the techs. And had the physician spoken first, would we have had as valuable a decision as starting with the technicians who have incredible insight, but probably wouldn't give that insight had they been speaking after physician. They didn't want to go first. That's completely, it's a way a military briefing works. The lowest ranking person always goes first, so as not to be influenced. And I think there are a lot of military type principles, and I don't know, they're military, they're leadership things. They're things that are just common sense when you're coming to either a consensus, or when the consensus is not what you're going after, you have to make a decision. And when we in this room come to this decision, and half of us don't agree with it, but when we walk out of here, we all have to agree with it. That's the way it is. And if you're not okay with that, then maybe you can't be on this team. But we come together. You may not agree with it, but you understand it. Don't go out there and say, oh, I didn't think this was, we had disagreement. This is why it was chosen. I understand it. I don't necessarily, completely endorse it, but this is what we're doing and this is what we've decided. And those are very, kind of military, but they're just regular common sense principles, seems to me.
Mm-hmm.
Do you have a vision for the future? For yourself, perhaps, but also for your organizations that you support?
Yeah, so care coordination. Why is it that if you get discharged from a hospital, you have to go to a pharmacy? What about the medications were brought to you? Why is it when you go from one, like a hospital to a post-acute nursing home, it's as if no one has ever, there's no information at all? Why is it that when you go into a different part of the healthcare system and you put all your information in and given it, that you have to do it again? It's care coordination. Why can't we get organized? And that really is what we're doing. That is really what we want to move to, because we don't have enough money to keep paying for disorganization. We have to really look at the cost per episode of care, and we can provide better quality at lower cost by coordinating, and we really can. And so with electronic records, which we've done, this city, Cincinnati, every hospital has the same electronic record called Epic. And they actually begin to communicate with each other, called Care Everywhere, so that if you were seen in this emergency room and the next day seen in this emergency room, that information is available. You had a horrible penicillin reaction yesterday. Well, we know that today, because you can't talk to us because you're having that reaction. And that's it, coordination of care.
Well, we're just about out of time.
Is there something that you'd like to share with the audience as something that's going on at the hospital, something that they can participate in?
Yeah, I would. So coming up, March 15th is the mini marathon, which Mercy is a sponsor of, from the American Heart Association. It's on a Sunday. It's downtown. It's a great thing to do, and it supports a great organization, the American Heart Association. And so get on the website, sign up. It's a precursor to the PIG, and have a good time.
Thank you. Thank you, Dr. Feagins. We were here today on Tips from the Top with Dr. Stephen Feagins, the Vice President of Medical Affairs for the Mercy Anderson and Mercy Clermont hospitals. Please join us again next time. I'm Rick Barron. I'm here with my co-host,
Veronica Sanford.
Thank you.